about, it's something that is near and dear to my heart and to many of the patients that I have the privilege to work with. And so today, the goal for us is to be able to offer an overview of some of how we're thinking about ways to live well in the context of some of these changes, cognitive changes that come about. As Alexa mentioned, I'm here at UCSF. I've been here since 2008, and really I'm here to study and work with individuals who experience changes as it relates to brain tumor care, as it relates to that. So in this work, I help patients and their families find ways to live well despite these cognitive changes that they're experiencing. And today, I'd like to discuss some of the typical challenges and changes that individuals go through and how we're thinking currently, our current research thinking about ways to help with that, as well as the role of neuropsychology, and more important, give each of you a space, if you choose, to be able to talk about ways that you found to be able to manage some of these challenges and get support around that as well. So we know that cognitive changes are very common in cancer, and all that much more in terms of brain tumor as well. So all of us from time to time have had experience of forgetting a word we're trying to say, forget our keys, going into the other room and not remembering why we went in there. And these are common lapses that everyone experiences even before they've had the diagnosis of brain tumor, can be especially so whenever we're feeling tired or stressed. But cancer-related thinking changes are even more common. So, and cognition really can be defined as a mental action or process of acquiring knowledge or understanding through thought, experiences, and the senses. So here, this is a recent study, well, not recent, but it's a study from 2016 from Schmidt, where really talking about the experiences of individuals as it relates to their cancer. And you can see the CNS cancer is one of the top cognitive impacts as it relates to all other cancers, breast cancer, all the way down to prostate cancer. And so these are very common changes that patients themselves come in and talk about with their providers. And we really are only at the infancy of understanding the impact of this, the natural history of cognition as it relates to, the journey through time, as well as what then ultimately to do about it, right? So that is really where the rubber hits the road. We want to have an opportunity to do something, partner with patients to be able to do something about it. So more than 50 to 70% of individuals with brain tumors are thought to have some cognitive changes, with patients reporting greater than 80% of cognitive symptoms in the space related to brain tumor. So cognitive changes can occur over time, and it can occur at the time of diagnosis, during treatment, or even several months or years after the treatment. And that they're often described as one of the more distressing things that come up and can have a high impact on quality of life. And day-to-day activities that were once automatic can now take more time and effort, and sometimes even need help to be able to do those things. And there may also, one thing that a lot of my patients talk about, it might not be readily apparent to other people. So caregivers, spouses, family members, friends, they might feel as though the way you experience your cognitive changes and the way that they experience you in conversation, there might be a big difference. I've heard a lot of patients say that, well, my wife says I'm doing just fine, or but I don't feel fine. I feel like I'm not quite myself. Or there can be behavioral changes that can really disrupt relationships. For example, thinking before or speaking before one thinks, and some of these things that are really common in the context of brain tumor that can really have a very challenging impact on people's day-to-day. And so even though these cognitive changes or these thinking changes can be invisible to other people, it can still be a very real problem. So these are some of the things that whenever I talk with my patients, many of them describe feeling very distressed by forgetfulness, slow thinking, having a hard time multitasking, and these are some of the ways they talk about they experience that. I don't feel like me. I feel isolated. I'm not really on the same page with people like I used to be. I don't want to be a forever patient. My tumor is doing fine. Why am I still having some symptoms, some changes? I'm so distracted. And there is a sense that over and over of just feeling isolated, and that this is something that I think that can be quite painful for many of the folks that I work with, and in many respects, finding that support and that place to problem solve what we can be a real start in the right direction. And since we know that over 82% of patients will experience some cognitive and emotional changes in the midst of their medical course, all the more reason for us to think about what to do to provide services to address these issues. So when I give percentages, just know that those are studies that are messy. They are not. They have lots of different tumor grades. They have lots of different time points with which to they're ascribing or finding these challenges. And so the data is what we have. And so when you hear me kind of talk about some of these percentages, you might wonder to the degree that applies to you or where we get this information. So we're happy to provide more information at the end, or even send out some of the literature if folks would find that helpful. So I mentioned that because I have said quite a few numbers and not necessarily talked about that component of it. So when we talk about cognition, I want just to make sure we're holding the same frame in terms of, so attention and concentration. It's the ability to focus, respond to information. It's be able to pay attention in the moment. There's lots of different types of attention and concentration. There can be, be able to sustain your attention over time, to be able to resist interruptions. That's another type of attention. But you can also just to focus, you can think about it as getting locked in and staying locked in, and being able to do that for a certain amount of time. That's really what attention and concentration is. It's being able to keep it live in your mind without getting swayed in terms of active thinking. Memory is the ability to, you have to encode it. You have to be able to get it in. So you need attention and concentration to get it in. And then you have to be able to register like, oh, that's in there. And then you have to consolidate it, or you have to kind of mush it all together to be able to then make sense of it. But then you also have to retrieve it later. So at any part of the chain, that there can be challenges, but there's also strengths at each part of the chain there too. So what I help to do is try to pinpoint where is it that you're really strong. You can get the information in, but maybe, and it's in there, but you can't get it out. So we need to work on strategies to be able to get it out. So that's a kind of a functional way to think about memory is it's getting in, it's storing it, and then getting it out later on. And then executive functioning is really, I think about it as the conductor of an orchestra, for example. It tells which one needs to go first, how to plan that, how to make sure that there are certain actions before other ones, so in sequence. It also makes sure that we're able to anticipate and being able to quell the impulse to do something if something else is more important, so prioritization. And so it's really the implementation sometimes and the ability to seamlessly implement some of the more basic aspects of our experience. So it can be very challenging and very common challenge for many of the patients that we work with. And processing speed really is the speed at which we can do something. So for example, if we end up with, for example, in a conversation, and I am having a hard time thinking of the word that I want to say, but then it comes to me, oh, that's right. I wanted to talk about this or that or this or that or this or that. So that thinking speed in combination with other cognitive abilities, such as being able to speak clearly, remember what I want to say, keep that in mind all the time. That also can have a component as well. So if we need more time, for example, say we have good attention concentration, we can remember and retrieve things, but we're a bit slower and we can't do more than one thing at a time. So our attention and concentration is good. Our memory is pretty good, but we have a hard time being able to do more than one thing at a time, and we can't do it as quickly as we once had. So that gives you an idea of really we need to take into account the whole picture to be able to see, oh, well, maybe I need to try to adjust the way in which I approach things and try to do as much as I can in advance. So that way I'm not under such time pressure in the moment, for example. So the more that we can begin to not just understand the challenges, but also what are our amazing gifts, what are our things that we're really good at, that can help us to inform some really elegant strategies then to know what to do about it. So I want to hand it over to Alexa to really share her expertise as it relates to cancer and treatment effects on cognition and some other really important aspects that are important to the patients that we serve.
Thank you, Chris. And as Chris already mentioned, for many people living with a brain tumor, cognitive changes are often part of their management of their disease. And commonly, individuals experiencing changes usually leading up to their diagnosis, but after diagnosis, other factors such as rate and spread of brain tumor growth, surgical management, chemotherapy, and radiation can impact one's cognitive experiences. We also know that some medications that are commonly prescribed to manage brain tumors and its side effects, such as steroids and anti-seizure medications, can influence cognition. Next slide. But while we know that much of one's thinking changes is often related to the tumor and its treatment, this is not the whole story. And this is what I'm really passionate about. As we continue to learn more about the brain and cognition, there's a growing understanding of modifiable risk factors associated with cognitive changes. There are many medical, psychosocial, emotional, genetic, and lifestyle factors that can influence cognitive performance. And while some of these factors we have very little control over, like our family history or genetics, there are modifiable or manageable factors and risk reduction strategies one can consider when it comes to maintaining and protecting healthy brain function and cognition. Next slide. So what are some steps, or what are the first steps one could take to help manage some of the cognitive changes that they're experiencing? If you are noticing changes with your memory or thinking, this is a great opportunity to let your medical providers know about your concerns. It's a very surprising thing to hear from many people in our community saying that they've experienced these cognitive changes for so many years and months and have never even mentioned it to their medical team. And so I really want to, one of my takeaways today is that if you are experiencing cognitive changes and are bothered by these changes, to first kind of address this with your medical team, because talking to your medical team and letting your doctor know, it will show them that it's important to you, and that they can also start thinking and screening for potential additional risk factors. There has been plenty of research and data that has shown that many medical conditions like uncontrolled hypertension, hyperlipidemia, high cholesterol, for example, diabetes, can be a risk factor for cognitive changes. So when thinking about cognition as well as one's overall well-being, having close medical management of these comorbidities is very important. And we also know that there are many hormonal imbalances like high or low thyroid or cortisol, nutritional deficiencies such as vitamin B and iron, and certain medications that have adverse effects on the central nervous system, which can potentially cause cognitive effects. So beginning a conversation with your doctor about your concerns and having a very careful medical assessment and medication review to potentially identify certain modifiable risk factors that may adversely affect cognitive function is always a great first step. But what are some things, or what's some things that one could do to help keep the brain healthy to support cognitive function? There's a lot that we can learn about from the mind-body connection. There have been numerous animal and human studies that have shown that chronic stress, anxiety, and depression over time can influence brain structures and connections in the brain, which have negatively impacted memory and cognitive function. Knowing this, one of the things that we do in the neurocognitive clinic is closely pay attention to one's mood and find strategies for stress and anxiety reduction. If you're having worries, feelings that are weighing you down or making you feel exhausted to the point where it's interfering with your day-to-day life, we do strongly encourage you to reach out to your medical team or oncologist to get support. And as a reminder, as your facilitator, as well as other members of your community here, we are here to help you as well. So please lean on us if we can be any help in any way. And when talking about cognition, it can't be stressed enough how important sleep is. Research suggests that during sleep, the brain clears out toxins that build up during the day, which allows the brain to think and operate at its best. Numerous studies have found that sleep plays a critical role in memory, attention, and other cognitive domains. Also, sleep is a period of time when the brain regulates hormones and the body forms new blood cells, which have a profound effect on our overall well-being. A few weeks ago, one of UCSF's psychologists, Dr. Neha Goyal, led a wonderful presentation on getting a better night's sleep. And this is a really great resource, which nicely overviews and highlights some great best practices and sleep hygiene strategies to get better sleep. The link to the webinar recording will be shared in our meeting chat box and follow-up email. And another important thing is that the brain requires a lot of oxygen to function, and these demands increase in thinking or completing a cognitive task. When there's a lot of inflammation and stress on the body, there is reduced blood flow to the brain, which can make the brain vulnerable to cognitive changes. There are many research studies that have shown that a diet rich in antioxidants can reduce inflammation and in turn protect the brain. Today, I won't be specifically talking about nutrition and diet, but there are some wonderful resources out there for you, including individual and group consultation with integrative oncologist Dr. Donald Abrams at UCSF and watching some of the prior nutrition webinar recordings on the UCSF survivorship page. Physical activity is another integral component of managing cognition. Many studies across a variety of neurologically based diseases have found positive effects of reducing the expression of cognitive impairments. Engaging in physical activity and exercise also helps to manage stress and could be a real mood booster. In particular, several studies have associated aerobic exercise, such as a brisk walk, with better brain function. Making exercise a regular part of our routine also improves overall health and the intensity, but the intensity should be guided by your current medical team. And a quick note that at UCSF, we have a cancer exercise physiologist who works with brain tumor patients and caregivers one-on-one to help devise exercise programs that are doable and safe. And if anyone was ever interested in that, please feel free to reach out to me and I can get you connected. But last but not least, something to consider is cognitive rehabilitation. Chris and Melissa, that's their expertise. Cognitive rehabilitation and training are proven to be effective in patients with neurological conditions such as traumatic brain injury and stroke. And there's emerging evidence for efficacy with primary brain tumors, which is incredibly exciting. We are today going to focus on understanding the role of neuropsychology and cognitive rehabilitation in managing cognition and brain tumor. And to help us with that, I'm going to turn it back over to Dr. Jamora.
Sounds great. Thanks, Alexa. So how does neuropsychology fit into my care? So I have some of the things that some of my patients have talked about is maybe they have talked to their doctor about their cognitive changes, and maybe they found that conversation wanting, or they both decided, oh yeah, I think it makes sense for neuropsychology to be involved, but maybe some of my patients were like, yeah, but I really wasn't sure. I am not quite sure about this idea. And what does that really mean? So really neuropsychology is the study of brain and behavior relationships. So for example, when we want to whenever we want to come up with a word to describe something, there are particular networks in the brain that help us do that. And this picture kind of shows that dynamic view of when we look at something, all the areas of the brain that are involved in, and then being able to hear and understand and see something to be able to do something as simple as look at a picture or look at or hear a message and understand it. And at any point in this process, there can be challenges. And rehabilitation neuropsychology is really designed is a study of intervention, looking at interventions designed to improve one's ability to manage in those situations. And it really is a holistic approach that looks at the impact of cognition, the impact of emotions, also psychosocial barriers and other challenges that can negatively impact our ability to make it work. And there are certain areas of cognition that can respond to retraining, while other ones we need to kind of work around. And in truth, the best way to make sure you fully understand both your cognitive strengths and vulnerabilities is to undergo a neuropsychological evaluation, get that information, and work with a trusted provider, because you want to be able to trust who you're working with and feel helped by them, to then put together a plan to look at some strategies that ultimately can help you to be able to manage day to day some of the challenges you experience. Of course, this is something that's reimbursed by insurance, so you do need a medical provider to refer you. But oftentimes, it can be most helpful in situations such as advocating for workplace accommodations, returning back to school, or being able to, since the cognitive challenges that come up, they often come up in the context of what's going on with the patient as well as the caregiver. They both have really valid observations, and for those patients that have caregivers or other people in their lives that help them manage day to day, oftentimes it can be a really good place for us to put all of our heads together to put together a plan. That doesn't apply to everyone, of course, but for some individuals, they find that very valuable. So what is cognitive rehabilitation? Really, it's considered a systematic, applied set of strategies and services designed to improve your cognitive functioning. And really the idea is the mechanism by which people improve is based off neuroplasticity. So we know that after someone has surgery, there's swelling that happens, right? And then it can, over time, be, swelling reduces, and the healing by which continued neural connections happen is through neuroplasticity. So new neural sprouting happens. There can be a reorganization of cognitive function to other healthy areas. And there also can be an unmasking of dormant pathways. There are some areas that respond that have more an affinity to neuroplasticity. So for example, cortical areas or the certain parts of the brain versus subcortical areas or white matter. There's a difference in terms of response to neuroplasticity. Also, we know that certain treatment effects, such as radiation, for example, are the neuroplastic abilities are attenuated during healing from radiation, for example, or in the context of active chemotherapy. So we would want to wait to do an active treatment course of cognitive rehabilitation, and that at least that's the current thinking, pacing it during a time where the full neuroplastic mechanism is available to us to be able to redistribute function. So does that mean that you can't benefit all along the course? Of course not. People, can benefit from problem solving and, thinking through strategies all throughout the course. But, if we're thinking about the neuroplastic mechanism for change, we want to think about ways, the opportune times to be able to do that. So my patients don't end up feeling frustrated that they're not making any progress and they're putting all this hard work in. So we think about two ways. So retraining is actually repeatedly practicing a skill, such as doing computerized attention and concentration exercises. And doing repeatedly that skill, and it should have enough qualities in common with your day-to-day tasks, so that way there's generalizability. So you're working on this, you're working on your attention and concentration, but also the idea is then we want to crosswalk that to something that's important to you. So for example, like making sure that you remember your keys whenever you go in the door. And that's where the compensatory strategy comes into play, that then you're working on workarounds or being more efficient with the cognitive resources you have to be able to troubleshoot and anticipate some of the challenges, so that way it's not so challenging whenever you complete those tasks. So oftentimes those two approaches are used in combination, and sometimes they'll even be used in phases. So sometimes in rehab, depending on the constellation of the challenges, some patients will start with retraining to be able to get a good foundation, for example, for attention and concentration. And then we move into some of the compensatory strategies, so it's built in a kind of stepwise way. It's a very common approach because we want to have a certain improvement in abilities, and then but we need to crosswalk it then to things that are important to patients' daily life, such as using strategy training. Common disciplines that provide this sort of rehabilitation, generally neuropsychology, rehabilitation neuropsychology. Not all neuropsychologists are rehabilitation neuropsychologists. I want to make sure that's clear. And then also speech therapy and occupational therapy. They provide different aspects. They specialize in different aspects. For example, a speech therapist might focus more on aphasia or language and swallow, where an occupational therapist might focus more on like visual, spatial navigation and being able to do things day to day. So So some of my patients have heard this. We've worked through some of this material. So for some people, this might be repetitious, of which I apologize. But in terms of some interventional components that are really common to cognitive rehabilitation, have to do with managing fatigue. So we know that 40 to 70% of patients with primary brain tumor report having fatigue throughout their illness trajectory. And although fatigue is prevalent throughout their illness trajectory or their disease trajectory, cranial radiation remains also another common and significant contributory factor for many patients. And that there's some research that looks at that there's the culprit of neuroinflammation may also produce some changes in terms of melatonin production and also immunomodulating responses. So it's a very real challenge that many of our patients experience. And when we feel tired, we struggle being the best version of ourselves. And particularly, your brain has to work so much harder to complete the same tasks. As your brain works hard to complete those tasks, it takes more energy and effort than you otherwise maybe expect or other people would expect. And also, it can be somewhat invisible, where people might not realize how tired you are, or you yourself might not realize that you're hitting the wall or going into red as we talk about it. And the more that we can begin to incorporate this sense of checking in with ourselves in terms of, okay, where am I at? Am I green? Am I okay? Or am I going into the red where I'm really starting to lose steam and get burned out? We know that many of my patients, when they talk about their fatigue, they talk about that sometimes they have less energy and they run out faster. And it takes them much longer to recover. And those wide swings of symptoms where they feel okay, they do a lot, and then they feel like they just do a little bit, not even a lot. and they feel like that can be, that they really kind of pay the price, so to speak. And being able to be aware of that process and having some restorative practices in your back pocket to be able to help with managing that is important. So these are things that most people do a lot of times, right? So we're starting to run out of energy. We begin reprioritizing our schedules. Like, you know what? I really don't need to go to that meeting later on tonight. I'm going to skip that because I'm tired. We sometimes know that exercise can also help managing sleep. And just like Alexa talked about earlier, making sure that we're having a healthy diet. Fatigue. There's also some interesting research by DeLuca that talks about intrinsic versus extrinsic motivation. So, for example, if a long lost friend knocks on my door, even though I don't know that a long lost friend would knock on my door, but if all of a sudden I get this call from someone that I haven't heard from in a while, I was tired going into that conversation, but now I am like so excited and don't feel tired at all anymore. And that intrinsic motivation can stimulate the dopaminergic pathway and can help in some instances. But of course, after that, I'm going to feel a crash. So being able to just know those ebbs and flows of things and working with someone that can help you track those symptoms, intervening early on, and being able to have a restorative plan to be able to stopgap that is a crucial aspect of oftentimes what I'm talking about with my patients, especially in the beginning part of my work with them. Because again, what we want is there to be less symptom swings and fatigue. If that's a major component for them, that can be a part that we can address. Overstimulation. So this is something that I don't think is talked about a lot it's talked a lot about in the neurologic literature and the neurologic nursing literature, but it's not talked about a lot in recent times. And I think it's because no one had kind of really thought about, this actually applies to, this very common idea applies to not just traumatic brain injury patients, but also stroke patients. And so it's now just beginning to catch the imagination of researchers in a whole new way. So we know that, for example, when there's changes to the brain, that it's not filtering out and filtering in information as it once had. And so overstimulation or having less tolerance for noise, for light, for too much activity is very, very common. And that that oftentimes that there can be a link between sometimes tumor location, a temporal tumor. One of my patients with a temporal tumor, he really needs to wear noise canceling headphones in his house sometimes with his kids because it's just way too much. And that really helps him to be able to hang in there longer and make use of it more family time. So we talk about this catch it, check it, change it. So catch it whenever I'm like, oh, I'm starting to get overstimulated. I need to check myself in terms of check out what can I do to do something different, and then change to something that's going to be better. So, for example, maybe you don't go to the wedding for all of the activities. Maybe you go to the reception for just a little bit of time, but don't go into like the big, crazy, loud room where all the dancing is happening. I'm thinking about that because Alexa was recently talking about a wedding. And in taking a deep breath and taking a break, for example, and once again, trying to use some of the mindfulness to be able to even shut your eyes for just a couple moments and being able to shut out the noise for a few moments, that can surprisingly get some kind of brain break time. And tracking what type of cognitive rest works best for you and when. And those are some really important things that I think that can be done just about anywhere that can provide a little bit of stamina building. So we're I want to make sure that we have time for the groups. And so I'm just going to run through these next things a little bit more quickly. So for example, getting distracted or having difficulty finishing a task. So some of these things you're already probably doing them, but others, finding creative ways to introduce breaking things into smaller pieces, verbally talking yourself through the steps, for example. So if you're going in the other room, can't quite remember why you're there, trying to talk it out loud to yourself until you're in that other room. So that way you can continue to optimize your focus. Using placeholders when you take rest breaks. So having a Post-it note on the place where you stopped in a book, so that way you know where to go back to do something. Or you have a little checklist when you are or highlighting to be able to move from task to task, so you know where you need to go back to. For having difficulty recalling, so creating that to-do list, prioritized by urgency. Most of my patients have a to-do list, but when we begin to prioritize it by urgency, then it can become less overwhelming because you're really breaking it down into time pieces or bite-sized pieces versus it being of this long list that can be overwhelming. Developing routines and also having assigned places for items, of course, that's a very typical strategy that we can use to reduce forgetfulness. And then, of course, pre-planning and using and optimizing mnemonics in our planner to be able to do that. Those are all just like first line sorts of things to consider that you yourself can do on your own. Doesn't take any specialized provider to be able to do that, but it is a reminder that those things can be helpful. So word finding is something that many of my patients talk about having difficulty with. So slowing down your pace of speech. So oftentimes I call it William Shatner speak, where I'll pause ever so often and slow down my rate of speech. This is something that they took from the stuttering literature in terms of how to match word retrieval with processing speed and motor ability. So if we can begin to pause ever so often when we're talking and focus on our articulation, that can reduce some of the kind of more minor word finding problems. There's other things, of course, that you can do. And these are some other kind of things that can be helpful. So being able to take a breath if you can, because sometimes that stress response can make it that much harder to be able to find words. And gesturing helps, even non-specific gesturing. So even if you use your hands a bit more, there's some literature that supports that can help to prime then language as it needs to come out. Now, does that happen? Does that work all the time? No, that does not work all the time. Again, these interventions are oftentimes summative, where we have to then try out a few things and kind of being your own investigator to try out the combination of what will work for you. So getting things done can be really challenging day to day for all of us. And being able to work towards being able to get more done is the goal that many of my patients have. So being able to routinize daily activities. So if there's medications you need to take every day, being able to have a structure by which to make that happen. But you have a typical day that you follow. Pre-plan and prepare in advance. So for example, having your purse ready the night before in an area near the door, so that way you know to take it on your going and leaving. And you don't have to hunt for your keys because you already know they're there. Considering warning alarms, so 5-minute warning, for example, and I think I'm getting probably ready to get a 5-minute warning in terms of when is next. Many of my patients have trouble tracking time, and we do need to sometimes have warning alarms to be able to help us track time. Reducing sound and clutter, and linking behaviors that occur naturally. So, for example, if you always need to eat something with your medication, linking your meds and meals, especially if you're needing to take a medication 3 times a day and you typically have 3 meals a day. And color coding to-do list, again, by urgency. So again, that idea is we get more done if we don't have to problem solve in the moment when it has to be done, as well as how to do it. So if you can have a pre-assigned category to how urgent it has to be done. And this can be as complicated as having Trello, or as straightforward as having a piece of paper that's written in different tasks that are written in different color ink. The idea is you want to cluster things in smaller bite-sized pieces so that it's easier to get them done. And so this is looks like a very complicated way to get a task done, but this is a little bit of a taste of when a patient of mine has a complex goal, like, for example, going on a trip or needing to get a project finished. Oftentimes we need to really kind of go through it step by step. And this is one way in which to do that. And it's breaking the larger goals into smaller ones, problem solving to take the pressure off, and thinking about possible solutions to those problems before they arise, and tracking what works and what doesn't. And just being able to commit to learning what works for you, and how that oftentimes my patients have the best ideas in which to help themselves, and tracking that over time and doing a bit more consistently what works can do can make a world of difference.
Thank you, everyone. Thanks to Chris for getting us through the first part of the presentation and giving us all that great information. And thanks to everyone in the breakout groups for sharing their wisdom and the strategies that have helped them, and being, willing to share some of the challenges that they've been experiencing. So I know that a lot of people are really grateful to hear that they're not alone in experiencing some of these things. So I appreciate everyone's willingness to participate in that. So I hope you guys found it helpful as well. Getting some new ideas, maybe getting some support around some of the cognitive changes you might be experiencing. So for the remainder of our time here, I'm just going to run us through a summary of what we talked about earlier and kind of wrap things up. And then we'll sort of facilitate some question and answer and see if we can help get some of those lingering questions answered for you in the time remaining. Okay. So really just taking a look here, just to remind us where we were earlier in the presentation. We went over how, cognitive changes are really common with brain tumor and the related treatments that are experienced, and that, they're kind of multi-determined. There can be a lot of things that contribute to them. We mentioned, other medical conditions, sleep or fatigue issues, mood issues can be a huge piece, all these different aspects, some of which maybe like genetic components may not be modifiable, but some of them, like improving your sleep, might be. So it's something that there's a lot of different moving pieces for, but also offers opportunity for intervention. There's a lot of different things that can be modified and approached in order to help with some of these changes. So as we were mentioning, managing those things like fatigue, exercise, having a healthy diet, having emotional support, or having just a system of support in general around you can be extremely helpful in helping to feel that some of that weight and that distress of what you're going through is shared, and help with alleviating mood and reducing stress and overwhelm. Tracking what works for you to help manage your changes. Some of the suggestions that came up in our breakout group, at least, were, structuring your day so that you are doing tasks that are more mentally tasking in the morning when you're more mentally fresh and fresh and ready for the day and you haven't hit your fatigue yet, maybe doing more restorative or self-care practices in the afternoon when you know that you tend to have a tendency toward fatigue, and making sure that you're feeling restored for the day. Doing things like a gratitude journal, making sure that you're coming from a place of gratitude can really also help shift your mood in a positive direction if that's something that's really impacting your cognitive changes. Just a lot of things came up that were really helpful. So keeping an open mind as to what those things can be, noticing when things are helpful, tracking them, writing them down, sharing them with others, just bringing some awareness to what works for you, what doesn't, and what can we do about it. Cognitive rehabilitation can be really helpful for this practice. That's one of the things that we help do, is we help identify where those are areas of challenge, where you might run into some sort of barrier. We come up with strategies and ways to approach those that are going to be helpful and more effective, so that when you encounter those in future situations, that you have a tool, a strategy ready to go, and we prepare you to be successful in those moments, right? And it might not be a fit for everyone. A lot of people find that it's helpful. It might not be the best fit for everybody, but it's just something we're introducing to you today as a potential resource that could help. And exploring that option with your treatment team might be one opportunity for seeing if there's a resource that you haven't quite tapped into yet, or maybe some of you have, and is that something that would be helpful for you now or in the future? Or other different kinds of cognitive support options, depending on where you're located, what's available to you, what are ways that can help your cognition, as well as the other medical, psychological, all the other sort of resources that you might have been offered. What can they help provide to help support your cognition as well? So consider talking to your care team for some possible resources. Here at UCSF, at least, in neuro-oncology, we have the neurocognitive clinic. So the folks here are very familiar with us and are happy to refer you our direction if you're interested in it. So lots of potential options around here, and we're happy also to help you figure out locally, if you're not in our area, what other options there might be for you. Talking to your medical team is a great first step. Okay, so I think with that kind of summarizes what we were hoping to bring to the group today. Was wanting to, up here, we've got our email addresses. If you guys have any other questions that you think of later, any lingering things, or if you would like some additional support from us, feel free to contact us via email. But I'll go ahead and open up the floor to if others have just general questions from today, and see if we can help get some of those answered for you.